Welcome back to Medicare Minute, found on MedicareForIdaho.com. Today we will be discussing what options you have when it comes to Medicare. Previously, we discussed how Medicare Parts A and B covers approximately 80% of healthcare costs. 80% sounds great, but it's important to understand that the 20% not covered represents unlimited financial risk. In order to mitigate that risk, Medicare beneficiaries have two options. The first is known as a supplement plan or Medigap policy, and the second is an Advantage plan. It's important to note that under option 1, Medicare remains your primary insurance carrier and the supplement plan becomes your secondary policy, with coverage provided through a private company such as United Healthcare, Blue Cross, or others. An Advantage plan, on the other hand, becomes your primary insurance carrier with coverage provided through private companies. Advantage plans must include the same benefits found in Parts A and B. So which plan is right for you? Supplement plans are known as Cadillac plans. Three types of people that generally love these plans are those that are willing to pay for peace of mind, those that have major health concerns, or don't want to worry about finding an in-network doctor. Conversely, Advantage plans are better suited for those who want low or no monthly cost and are willing to manage their care. Also typically better for people in okay health and are fine with a network. In the next video, we will take a closer look at each option.